So basically, and her next question was, what is the diet? Like, so she asked one this thing that if there are 3+, what will be your advice for this?
See, 3+ proteins in the urine basically means that there is a significant kidney disease. And normally the initial wrong conception was, if you are passing proteins in the urine, you should eat more proteins because you are losing it in the urine. But that is not, that is a wrong consumption. So if you are having proteins in the urine, you should eat less proteins. So by eating less proteins, the protein loss in the urine is reduced.
That is means a proper diet should be accordingly, so that it is a less protein.
Yes.
Doctor, I think we have got a question. Hello.
Hello. Dr. Rao उलयताने.
Hi, विचारा.
Dr. Rao उलयताने.
Hi.
स्मिता उलयता पणजे साकून.
विचार.
म्हाका युरिनांतल्यान कॅल्शियम वता, युरिक ऍसिड वता, युरिक ऍसिड न्यूमरस, कॅल्शियम ऑक्झिलेटरी न्यूमरस, पण हांवें नेफ्रोलॉजीक दाखयलें आनी एक डॉक्टर आमचे जीएमसीनूच दाखयला. तांच्यांनी म्हाका आल्कास्टॅट दिलें, आल्कास्टॅन काही तरी, आनी ते म्हणटात काय ना, व्हडले काय प्रॉब्लेम ना, भरपूर उदक पी अशें म्हणटा. पण ताका क्युअर आसा काय ना हें म्हाका तातूंत कळुना अजून.
Normally in the urine, calcium oxalate crystals are present. Normally also if you are drinking less water and give urine sample, the urine will show a lot of crystals, and most of the times it is calcium oxalate crystals. So having 2 to 3 or 3 to 4 calcium oxalate crystals in the urine is normal. It means that the patient or the person has not drank enough water. But if you have plenty of calcium oxalate crystals or plenty of uric acid crystals in the urine, then it points that probably you have some pathology which is causing the urine to show those crystals. Now in that case, in her case, if she is having a lot of uric acid crystals in the urine, then one would probably advise her to reduce dietary uric acid consumption. So low protein diet, avoid red meat, avoid alcohol, and at the same time start treatment with allopurinol and those medicines.
I think she has already mentioned about one drug.
Yes. That she has to continue.
That
she has to continue with dietary
restrictions. I think, sir, we have got another question. Hello.
कुठचाही आजार असा हेरिडिटरी वगैरे आहे ना, जसा बॅकबोन वगैरे,
विचारात
त्याला काही असं मेडिसिन वगैरे काही असं आहे तर
म्हणजे
किडनीशी संबंधित.
Anyway, maybe that he is referring to the disorders of the kidney which are hereditary. Is there any treatment or how to go out? We'll just modify his question.
As I said, we talked about
polycystic kidney disease, correct?
Which is a hereditary, which is the most common hereditary disease of kidney. Now, त्याच्यामध्ये आता hereditary आजार असेल तर unfortunately, as I said, these are all genetic defects. आणि gene therapy अजूनही it is not
come in active form and giving
practiced in some areas in US and Germany, but it is not feasible in India. त्यामुळे precaution is the best cure याच्यामध्ये. आणि polycystic kidney disease उदाहरणार्थ जर आपल्याला hereditary असेल तर after the age of 30 years we advise to get an ultrasound done, and at the same time we advise to have low protein diet. We advise them to have regular blood pressure checkup, weight control. So basically healthy lifestyle and healthy diet with a regular checkup is what is advisable.
I think. Thank you, doctor. I think we have got one question. Hello.
सुप्रिया वाळपयच्यान उलयता. म्हाका प्रश्न हा की किडनी ट्रान्सप्लांट केलेल्या पेशंटान कसली केअर घेवपाक जाय?
सुरुवातीचे 3 ते 6 महिने आम्ही पेशंटना सांगतो की they should have home cooked food. Okay, and at the same time avoid going out in crowded places. Wear a mask if they are traveling in public areas or public transport. I mean, if they want to come to the hospital, they should wear a mask. And most important is that they should know what medicines they are taking, and they are supposed to take the medicines properly on time. So knowledge about medicines is very important for a transplant patient, because those medicines are lifelong medicines. He has to live them and have them regularly on time through his entire life. So that is the most important thing which we advise them. And at the same time, as I said, if they are diabetic, to make sure that the diabetes is well controlled. Most of the patients after transplant tend to put on a lot of weight. So we advise them to make sure that they control their weight, they have a regular exercise and those things. So this is
in general broad guidelines. I think, doctor, we have got one question. Hello.
Hello.
Yeah.
My question is Dr. Shital.
that day by day the kidney problem is increasing in Goa, and mostly at the end stage it is diagnosed. So my question is, at the first initial stage, why it is not diagnosed by the general physician?
Why it is not diagnosed in the initial stages is because the disease is silent, and the patients don't have any symptoms.
Correct.
So the general physician or the general practitioner really don't doubt that this patient might have a kidney disease.
Correct.
So what we advise to patients, and even in our medical meetings to the general practitioners, is if you have people who are at high risk for kidney disease, you keep a doubt of kidney disease always in the mind. There are certain people who are at high risk, and those are people who have diabetes, people who have high blood pressure, people who are above the age of 50 years, people who have a family history of kidney disease, people who have had any other kidney disease in the past or as a child, people who smoke. So these are the sort of high risk category in whom we strongly suspect kidney disease, and in them we do their annual checkup or regular examination on a periodic basis. So what she asked is true, that most of the times it is not
detected
early because it is silent.
Correct.
Neither the patient
complains
nor the doctor suspects.
Correct. So basically
high
it
risk
is
category has to be
evaluated
and kept in mind.
According with the line of this, as you said, Dicky, there should be regular periodic checkup, like about your urine, your renal function test, ultrasound. I think
for that reason we also conduct a lot of screening camps, awareness programs, so that people are aware about kidney diseases. People are aware about what is the importance of kidney in their body, and how to take care, and what to do if they have any kidney disease, and how to diagnose them early. So if people are taught and if they are made aware, then disease control can be very easy.
Correct, absolutely. So definitely we can hope for a good functioning kidney for a healthy person, so that everything of proper care, because finally this is a excretory system. If that is defective, then all your functioning of the body can go in wrong directions. I think आजच्या ह्या कार्यक्रमात तुम्ही आम्हाला बरीच महत्त्वाची अशी माहिती दिली. आमच्या सगळ्या पळोवपा खातीर डॉक्टर शीतल लंगडेन अतिशय महत्त्वाची मोलादीक अशी माहिती दिल्या, जाचो वापर आमकां सगळ्यांक म्हणजे प्रत्येकाक म्हणजे दुयेंस आसा ताकाय बी, दुयेंस ना ताकाय बी, ज्या पद्दतीन आमी दुयेंसांचेर कंट्रोल दवरूं टाळू शकता, तसो आमचो आहार आसा, जशें उदक भरपूर पिवपाचें डॉक्टरान सांगलां, व्यायाम आसा, जंक फूड खावं नाकात, ह्यो तरी सोरो पिवं नाकात, सिगरेट ओड नाकात, हे जे कांय महत्वाचे तेंच्यांनी आमकां निर्णायक अशे महत्वाचे अशे जे आदेश दिल्या, तशें हांव म्हणटा की ते सगळ्यांनी पाळप तितकेंच महत्वाचें, सो दॅट वी कॅन एन्जॉय गूड हेल्थ. येता त्या कार्यावळीन आमच्या बरोबर दुसरे फावटी आसतली डॉक्टर विमी मोदी, जी गोंयच्यो नामनेच्यो डर्मॅटॉलॉजिस्ट म्हणजे कातीच्या दुयेंसांची किंवा त्वचा आरोग्य तज्ञ डॉक्टर विमी मोदी आसतली. त्या खातीर तुमच्यांनी तयार रावत, तुमचे जे कितें प्रश्न आसात ते मनान तयार दवरात. येता त्या बुधवारा आमी तुमच्या प्रश्नांक रावतले. तुम्ही बी आमची वाट पळयात. तो म्हणसर आयची कार्यावळ तुम्ही बऱ्याच थोडोसो कालावधीन उपरांत परत आमी आयले, तितक्याच मोलादीक आत्मीयतेन आणि प्रेमान ऐकली. ह्या खातीर तुमकां काळजान सांदेव बरें करूं. परतून मेळया येता त्या कार्यावळीन. हॅलो दोतोर. नमस्कार.